Health Campaigns Together is a coalition of organisations, so we invite CLPs to affiliate to Health Campaigns Together. But if you're an individual member, you want to campaign your local area, Keep Our NHS Public is the organisation for individual members. That's the way we work together, but we've worked hand in hand since the formation of Health Campaigns Together. But what we want to be doing is that combination of addressing the national issues that we've been hearing about and the local campaigning, which Steve touched upon, and which is also absolutely essential if we're going to defend our NHS. We cannot wait until the election. We cannot wait until a new government starts to sort it out. We have to be fighting things that are actually taking place in our NHS locally now. And there's a whole series of attacks that are going forward at this moment that we need to be aware of and confronting. In most of the country now, in almost half of the local clinical commissioning groups, there are plans for mergers of clinical commissioning groups into vast bodies covering huge areas and diverse populations, which would take away a local voice for local people, eliminate statutory duties to consult and so forth on a very wide scale. And if anybody doubts that's actually what's happening, in the Health Service Journal last week or so ago, we had a quote from somebody leading that process in Lancashire and Cumbria, where he got up and he said specifically, we need this merger so that we can enforce proposals, majority proposals through. And we need to get to be able to carry through tricky arrangements, right? Tricky things which he knows local people will oppose. Now this is taking place across the country, and it's an attack on the actual element, one of the very few, I think probably the only progressive element out of the 2012 Act, was it actually gave some local accountability through CCGs. And it set up 211 of them. It's already down to 191, and NHS England wants it reduced to 40.
Oh my goodness.
40. In other words, a massive reduction in local accountability. These are the bodies that you can actually read the board papers, you can go to their meetings, you can challenge what they're doing, and on major changes they're expected to consult you. Now this will cover areas, in northwest London it's 2.2 million. In other areas it's 1 million and more of people, different communities. That local voice will be lost. Now what we've still got as a result in that situation is the local council scrutiny committees, and they start to play an even more important role. And this again, where the Labour Party, Labour activists can play a role, making sure that local councils actually use the powers they have through scrutiny. They can refer things that they're challenging to a reconfiguration panel. Hospital closures, other issues they can challenge. And they have residual powers left over from the community health councils way back in the 1990s. Those powers are still there to force a status quo while that referral takes place. So it's really important that where controversial challenges are being put through and changes are being put through, that councils get up and use those powers. So we need pressure on those local councils. We need campaigns. We need every cut and closure, every move to privatise that actually comes into public view to be challenged on the spot, and make it a fight. Make it something that local politicians can't get away from. Because again, what we've seen is where local MPs from whatever party are put under pressure, they will feel obliged to actually represent in some way or other the movement that's challenging those changes. So we've seen interventions behind the scenes by Tory MPs in Essex to stop the rationalisation of A&E services in Essex. They haven't stopped all the changes, but they've stopped them. We've seen in Devon the proposals to merge hospitals in Devon and close hospitals down in Devon. Again, a Tory MP famously threatened to resign the Tory whip and chain himself to the railings outside his A&E if they shut it down. I was longing for that to happen. Just to see. But actually, he knew by the time he'd done that, in fact the deal had been done. And the review, uniquely, of any review I think I've ever seen, came out saying, well, all these A&Es are needed right across Devon, and they stayed open. So it is possible. You put pressure on MPs, you put pressure on politicians, you can force changes, or at least you can force a delay that can make it possible to strengthen and further strengthen the campaign and expose the weaknesses in the plans that are coming forward. So I think it's really important we don't just see this as a campaign of national propaganda. There's huge national issues we do need to be taking up, and we are trying to take them up with whatever means we have. But it's also important we have local campaigns that really get stuck in to challenging local changes. And in doing that, this is where most of the victories have been achieved over the last few years. We have forced back a whole series of changes. We've got colleagues here from the Lewisham Hospital, right, which was saved as a result of a local campaign. Had we just waited for national campaigning to change the government, that hospital would have gone, right? And the same with the North West London challenges over Charing Cross and Ealing Hospital. The campaigning meant it was delayed. The holes in the scheme became manifest, and in the end, even Matt Hancock had to knock it on the head and admit it wasn't viable anymore. So these things can be done. Local campaigns can win, and to work together, we build maximum impact. Health campaigns together were set up from 2015 to respond to the Cameron government threat. The Cameron government threat, a majority Tory government elected that year, and the threat that was going to pose of further privatisation, further inroads. We said we had to get together, the unions, the campaigners and political activists of whatever party that want to get involved and fight these questions. If you want to defend the NHS as a public service, if you want to keep privatisation out of the NHS, if you want to keep it out of trade deals, if you want to defend your local hospital or your local service, if you want to keep mental health services at a point where people don't have to travel 250 miles to access a bed when they need it, if you want the proper resources, then you need to be joining with us in a joint campaign. It's got to the point, even NHS providers, the body representing the employers, has now mounted a campaign for the resources to actually maintain our hospitals. They point out the capital bids, the capital allocation for the NHS now is not enough even to pay the urgent maintenance bill on the hospitals, let alone improve and build new resources. That's NHS providers. Now, we as campaigners know we want to go a lot further than that. We've heard a lot of, all of Jonathan's proposals, which I think are excellent, all the other issues that we want addressed. We have to do that by a combination of local action, local organisation, get mobilised, get challenging, get fighting, national action, coordinated action, and of course, in an election, we will be campaigning, vote NHS, as we did in 2017, vote NHS, and in practicality, we know that means vote Labour. In reality, that means vote Labour. Very few areas where it doesn't mean vote Labour. We retain our party neutral stance in a technical sense, because actually we're working in all kinds of areas of the country where it's not an issue of actually still simply building a Labour vote. It's an issue of challenging and building a coalition that can involve Tories, women's institutes, God knows who, mobilised in some of the rural areas and places we have to challenge hospital cuts and closures. That's why we're party non-political, but by golly, it's a political question. It's a political campaign, and we intend to fight it. And we intend to show the full record of what's happened since 2010. The way our NHS from 2010 been systematically underfunded, disintegrated and privatised by a bunch of cowboys who basically want to hand it over to the biggest cowboy of the lot. So we need to actually make sure that doesn't go any further. So we're hoping that out of this meeting, you don't just go away thinking that was a good meeting, because I think it was. But you also come away committed to work with us, join with us, and build a campaign, a united campaign that can actually build a real challenge, make sure NHS is not just a factor in the election, but a factor in the new pressure on the new Labour government to ensure we can hold Jonathan's feet to the fire and ensure that he does what he says he's going to do. Thank you very much.